lymphatic system consists of lymph, lymphatic vessels, and lymphatic organs. Okay. The lymph, which is the liquid part, consists of interstitial fluid, lymphocytes, and macrophages. The lymphatic vessels pass through lymphatic tissue, and they pass through lymphoid organs. So your lymphoid organs, okay, the primary organs of the lymphoid system, lymphatic system, are your thymus and the bone marrow. Secondary organs are the tonsils, lymphatic nodes, which are axillary, lumbar, pelvic, and inguinal, your spleen, and your mucosa-associated lymphoid tissue called MALT, M-A-L-T. Okay. This is an overview of the lymphatic system. You can see where you have inguinal lymph nodes, you have pelvic lymph nodes, you have your mucus-associated lymphoid tissue, you have your spleen, okay, you have lymphatics of the mammary glands, you have a left lymphatic duct coming up through the thoracic cavity, you have your axillary lymph nodes, okay, lymphatics of the upper limb, you have your tonsils, okay, your cervical lymph nodes, around the lower jaw there, you have the right lymphatic duct, we'll get into that here, you have your thymus, the thoracic duct, the cisternae chili, which is where the lymphatic system starts, and the lumbar lymph nodes, and then lymphatics of the lower limb. That's your lymphatic system. It runs through the body. The functional lymphatic system, the main function is to produce, maintain, and distribute lymphocytes. That's what it does. Produces, maintains, and distributes lymphocytes. You maintain normal blood volume and normal composition of the interstitial fluid. It provides an alternate route for the transportation of hormones, nutrients, and waste. So instead of going to the bloodstream, hormones, and nutrients, and waste can go through the lymphatic system. Functional lymphatic system. Primary lymphoid structures causes differentiation of lymphocytes. So it takes these lymphocytes and it differentiates them into T cells, B cells, and NK cells. The secondary lymphoid structures, okay, those are considered to be the front line of defense. They're lymphocytes and more B cells. They consist of lymphocytes and B cells to battle infectious agents. Okay, the T cells are ones that attack anything in your body. The B cells are made from a response where something is found foreign in the body. In other words, that the body triggered, the B cell thing is foreign, all these little flags go up and tells the T cell to destroy it. These are kind of the little messengers that bind to antigens, I'm sorry. They form antibody. So the maintenance of normal blood volume and chemical composition of the interstitial fluid is a function of your lymphatic system. The blood pressure in the lymphatic system is about 35 millimeters of mercury. So it's less than the systemic circuit, but it's more than the pulmonary circuit. This pressure forces solutes and waste out of the plasma into the interstitial fluid. This interstitial fluid enters into the lymphatic system. The lymphatic system drains back into the venous system. So it's all continuous. So lymphocytes and everything produced, everything gets formed and it gets drained eventually back into the venous system. So it's a continuous motion. So here's your arterioles going through, okay? They provide pressure, it exits into the interstitial fluid, and then from the interstitial fluid, it goes into the lymphatic system, lymphatic capillaries. And lymphatic capillaries is where you fight infections, where you monitor things that are in the body. It looks for any pathogens. Okay. So it provides an alternate route. Instead of going to the bloodstream, you can have hormones, nutrients, and waste products going through the lymphatic system. Okay. Examples of nutrients, some lipids are absorbed by the digestive tract and carried through the bloodstream through the lymphatic system. So absorb some of the lipids that can't absorb in the bloodstream, goes to the lymphatic system, and then they get dumped back into the venous system and get circulated through the body that way. So hormones, nutrients, and waste products can all go through the lymphatic system as an alternate form of going through the cardiovascular system. Again, this is your bloodstream, your blood arteries. It gets the pressure forces waste, nutrients, mineral, different types of nutrients into the interstitial fluid. From there, it gets picked up into lymphatic ducts and exposed to lymphatic capillaries and goes through the lymphatic system. We're exposed to B cells, T cells, lymphocytes, and everything's monitored. Okay. In the lymphatic system, okay, there's three main roles. It's part of our immune system, maintains the fluid balance that is essential for absorption of fats and fat-soluble nutrients. So lymph vessels drain fluid from all our tissues. Okay, it controls our fluid balance and delivers foreign material to the lymph nodes to be assessed and determined if they're harmful by our immune system. So the lymph nodes swell in response to infection. That's why if you have those swellings underneath the sides of your chin, that's your cervical lymph nodes. When they get infected, they swell up. Okay. The lymph nodes swell in response to infection, so they're called swollen glands due to a buildup of lymphatic fluid, bacteria, other organisms, and your immune system cells. So it builds up in there and it causes the lymphocytes, the lymph nodes to swell. Okay. Lymph nodes can also become swollen due to direct infection, like cancer or other disease or conditions can also cause swelling up. They're responsible for filtering lymph, providing part of our immune system response to new pathogens. Okay. New pathogens are something our body does not recognize as foreign right away. So the lymphocytes determine if it's foreign and then mark it. We build antibodies and discover it as foreign to our bodies now. So those are new pathogens being exposed to our body going through our lymph nodes. Disorders lymphatic include lymphedema. Lymphedema is a swelling that occurs when lymph fails to drain back to the lymphatic vessel and gets backed up. And then just that body part will swell up, leg and arm, etc. Can get extremely large. Elephantitis, disease like that are part of lymphedema, where it fails to drain. Swollen lymph nodes can indicate a response to foreign material, like a nearby infection. This is lymphadenopathy, okay, when they swell up. Complications of lymphedema. Okay. Repeated exposure of cellulitis are common in patients with lymphedema. Cellulitis is infection in the cell. Bacterial infection of the dermis, the deep layer of the skin, and the subcutaneous tissue underneath the skin. Lymphangitis, the infection of the lymph vessels caused by Streptococcus bacteria. If it's untreated, it can spread to the skin, causing cellulitis, or to the bloodstream, causing septicemia, which is sepsis. Both can be fatal. Lymphedema can affect the way the patient looks. Swollen arm, swollen leg, like we said, elephantitis, which in turn have a psychological impact. Patients with lymphedema have a high risk of developing depression as their body maintains those large portions because it cannot drain lymphatic fluid. So small lymphatic vesicles, okay, are called lymphatic capillaries. Just like small blood vessels are called capillaries, small lymphatic vessels are called lymphatic capillaries. Large diameter lymphatic vessels are called lymphatic ducts. So we have capillaries, which are small ones, and ducts, which are our large ones as it drains through. Lymphatic capillaries compared to vascular capillaries. Okay. Lymphatic capillaries are larger in diameter, so they're larger than our blood vessels, larger than blood capillaries. They have thinner walls. Things flow through them more readily. They have an irregular outline. Remember, our blood vessels our arteries are round. These are irregular outline. Lymphatic capillaries have anchoring filaments that hold them in place. Our small lymphatic systems don't have that. Connections surrounding connective tissue to keep the capillaries open. So it keeps the lymphatic capillaries open. Lymphatic capillaries have a greater permeability. Okay, larger diameter, thinner walls, greater permeability. Allows things to flow into the lymphatic system easier. Okay, they also have veins. You see the lymphatic vein right here. This prevents backflow. So as blood flows through here, the vein opens. As it starts to go back, it forms in these pockets here and forces that vein shut. Okay. So again, the vessel, just like in veins, our lymphatic vessels have valves. Arteries do not. Okay. Lymphatics run in parallel with our arterial system and our venous system, our arteries and veins. So here's your arteries, here's your veins, and this is the lymphatic system running back towards the heart, towards the venous system. Okay. So here's what an artery looks like, which is round, a vein, which is a little irregular, and the lymphatic system is a lot irregular if you take a cross section through them. So very irregular shape are lymphatic vessels. Arteries are round, veins are somewhat round, kind of distort a little bit. Lymphatic vessels are really irregular shaped. Okay. So comparing larger lymphatic vessels to veins. Lymphatic vessels have thinner walls. They have larger lumens. They're regular, but they're larger openings. Okay. They do not have the tunics like our vessels do. They do not have the 3 layers. They're not easily identifiable. And the larger vessels have valves, just like our veins, to prevent the backflow of lymph. And there's a good picture of the vein. You can see it right here. How that's closed. So if blood flows this way, it backs up. If blood flows this way, that valve opens up and allows it to pass. Okay, so valves in lymphatic vessels. Pressure in lymphatic vessels is lower than pressure in the veins, right? Our lymphatic system runs about 30 millimeters of mercury. Our veins run away from 120 over 80 or somewhere around that region. The blood gets pumped through our systemic system. Valves prevent the backflow of lymph, just like valves prevent the backflow of plasma in our veins. Skeletal muscles contract to help propel lymph, just like our venous system. Inhalation, change in thoracic pressure, helps move the lymph towards the venous system or subclavian veins, just like our venous system. So there's our similarities. Okay, it has valves. It uses the skeletal muscles of the legs to help propel it up against gravity, and it uses a change in thoracic pressure to help propel it against gravity also. Right? But the pressure is lower than it is on our systemic system. There's 2 sets of lymphatic vessels. There's superficial and there's deep. Superficial is found in our subcutaneous layer. It's found in the mucous lining of the digestive tract, respiratory tract, urinary tract, and reproductive tracts. Okay, it's found in the serous lining of the pleural, the pericardial, and peritoneal cavities. Those are superficial lymphatics. Our deep lymphatics collect lymph from your skeletal muscles and tissues of the neck, limbs, trunk, and visceral organs. Okay. So 2 sets of lymphatic vessels, deep and superficial. Okay, those converge. The superficial and deep lymphatic vessels converge to form what's called lymphatic trunks. Okay. There's 5 major lymphatic trunks as they flow towards back to the venous system. There's the lumbar trunks, intestinal trunks, bronchomediastinal trunks, subclavian trunks, and jugular trunks. Okay, those are your 5 trunks of the lymphatic system. Okay, you can see, here's your intestinal trunks, your lumbar trunk. See where they're pointing to. Again, those are below the diaphragm here. You got the bronchiomediastinal trunk, you got the right subclavian trunk, and the jugular trunk. Okay, the same on the left side. As these are going to form into large areas and born into your into the subclavian veins to form back fluid back into the heart, into the systemic system, to keep fluid from building up. Your thoracic duct drains directly into the left subclavian vein. Okay, the thoracic duct drains the lymph inferior to the diaphragm. So everything below the diaphragm, the lymphatic system drains through the thoracic duct. It drains from the left arm, the left side of the torso, the left side of the neck, left side of the head, the abdomen, and both legs. So all that drains from the thoracic duct. Okay, and here's your thoracic duct right here. So everything we said on the left side, so everything on the left side, the entire left side, head on down to the toe, and the right side below the diaphragm, all drained into the thoracic duct, which drains into your superior vena cava. Okay, so the entire left side and the right side below the diaphragm all drain into the thoracic duct and then into the superior vena cava. Okay, so here's the picture of it. So the entire left side and everything below the diaphragm, that drains into your thoracic duct. The right side above the diaphragm drains into the right lymphatic duct. Okay. So the thoracic duct collects all the lymph from the tissues on the left side and the right side below the diaphragm. The right lymphatic duct collects all the lymph drainage from the right side of the body above the diaphragm. Those are the two places that drains, and then both those drain into the superior vena cava, the thoracic duct and the right lymphatic duct. Okay. The thoracic duct begins with a sac-like structure called the cisternae chili. Okay. That's where the thoracic duct begins. Again, that collects lymph from the entire left side and the right side below the diaphragm. It starts at the cisternae chili. The right lymphatic duct collects lymph from the right side above the diaphragm.
So what's the reasoning for that? Why is it that it only does above the diaphragm?
That's how the lymphatic system developed. That's how it develops in embryology. When it forms a cisternae chili, that one system drains that entire area, and the other system drains just the right side. I don't know. There must have been some evolutionary advantage to how it developed like that, but they both perform the same function. They just drain certain areas. Yeah, there's no medical advantage of one or the other, but why they didn't divide it right down the middle for right and left, that's just not how it developed. There must have been, like I said, an evolutionary advantage to doing it that way. And that's how it develops now through embryology. So one drain, like the thoracic duct drains your entire left side, plus the left side, the right side below the diaphragm. The right thoracic duct kicks in and drains above the diaphragm on the right side. The head, the neck, and all that. Okay, and they both drain into. Like here's your where's your thoracic duct? Okay, this is a cisternae chili. That's the beginning of your thoracic duct. That's where it's formed from. Okay, and this all comes up and drains into the thoracic duct. And the right thoracic duct drains in from this side, both into the superior vena cava. So your right lymphatic duct collects, like I said, the right side, the right branchiomediastinal trunk, the right subclavian trunk, right jugular trunk. Okay, so that's your thoracic system. That's your how we drain the lymphatic system. So lymphocytes, we maintain them in the lymphatic system. Okay. The lymphocytes, those are your T cells, your B cells, your NK cells. Okay, those respond to invading bacteria and viruses. That's what they activate to. Abnormal body cells like cancer cells, foreign proteins like toxins that are released by some bacteria. Those are always, we all respond to those by our immune system, which is our lymphatic system. Okay. There's three types of lymphocytes: T cells, B cells, and NK cells. We talked about those a little bit before. T cells are your thymus-dependent cells. B cells are your bone marrow-derived cells, and NK cells your natural killer cells. Okay, T cells and B cells all develop in the bone marrow. T cells go to the thymus to become what's called immunocompetent, to mature. So the T cells travel to the thymus to become active. That's why they're called T cells, thymus-dependent cells. But they both start in the bone marrow. All three start in the bone marrow. So T cells originate in the bone marrow just like B cells, but travel to the thymus and become active there. It's called immunocompetent, is the terminology when they become active, by the thymus and produced by the thymus gland. You have different types of T cells. You have cytotoxic T cells, helper T cells, suppressor T cells, and memory T cells. Each of them performs a different function. Okay? The cytotoxic T cells, those attack foreign cells and viruses directly and kill them. They're phagocytic cells. So cytotoxic T cells attack and destroy foreign cells and viruses. Helper T cells. Okay, helper T cells help the B cells make more antibodies so the body can recognize them as foreign. So they help the B cells in making antibodies. Okay. Suppressor T cells stop antibody production. They suppress the B cells. You got to turn it off once the infection's gone. You can't keep it going. So helper T cells increase the amount of B cells that can be made into antibodies. Suppressor T cells slow them down, stop them once the infection's gone. Okay. You got to be able to turn them on and turn them off. And you have memory T cells. These memory T cells become activated if the same antigen appears in the body at a later date. Let's say you get alert responses to medication stuff. You make antigens to this thing, it hits, and you get the same response the second time. It gets exposed, and your body finds that it's foreign, and you react to it. Okay, so those are your memory T cells. Okay, they're when the same antigen appears a second time. It helps make the antibodies responding. B cells, they originate and become immunocompetent in the bone marrow. So they do not travel. Okay, so they start in the bone marrow and become immunocompetent in the bone marrow. B cells can differentiate to form memory B cells and plasmacytes. Plasmacytes produce antibodies that bind to an antigen. Little flag comes up and tells the T cells, hey, this is foreign, destroy it. Antibodies are also called immunoglobulins. Okay, when you have an infection in the body or an antigen, they bind to it, they respond to it, and they start tagging it. And it makes more of these antibodies. Those are the plasmacytes. And get more and more of these little flags that pop up. So you have, this is your virus here. Okay, your antigens bind to this surface, and it sends up these little flags. These little flags tell these T cells, hey, this is a foreign body. This is an antigen. Destroy it. So the B cells, these B cells are happening, mark the antigen for the destruction by the cytotoxic T cells. And then memory B cells become active if the same antigen appears at a later date. You get a mass production of antibodies, and your body tells you that's foreign if you see it again for the second time. So it help. That's how inoculations work for the flu, the flu vaccine. Okay, the flu vaccine is it's attenuated viruses. Okay, the CDC picks out 20 of the worst viruses every year. They put it in a vaccine, they kill them, so it's attenuated, and you get the injection. You cannot get the flu from the flu shot, from the flu vaccine. It's impossible. Okay, you might get a little response to it, but you will not get the flu from it, because what it is 20 different strands of the flu, and they're inactivated. Okay, but the surface antigens are still present. So the virus is attenuated, so it's gone, but the surface antigens are present. So the B cells, the memory B cells, they find that as foreign, and they flag it, and they make antibodies. Now your body has antibodies to the 20 most common types of the flu virus. So when the flu virus gets in your system, the real one, now you got antibodies to it. They find it's foreign, they flag it, they kill it right away. So you don't get the flu. Those 20 strains. Now, if there's a 21st strain, if you get that, you're going to get the flu. Vaccine's not going to help. They pick the 20 most common strains or predict. They try and predict what the 20 most common strains are, and that's what they inoculate you with. Okay, and that's how flu vaccine works. You don't get the flu for those 20 strains. NK cells, we talked about natural killer cells. Okay, they attack foreign cells. They attack normal cells that are infected with virus. That's the key here. Remember we talked about cancer cells. Cancer is so deadly because there is no silver bullet. Okay, it's our normal cells. So it's no flags. There's no surface antigens that say, hey, this is a bad cell. It has a cancer in it. It just develops our normal cells to mass produce at an alarming rate and forms tumors and massive growths and lots of other problems. But the body does not see it as foreign. These things, these natural killer cells, okay, they see our normal cells with no surface antigens, and they say something's wrong. Don't know how they do it. If we could do a lot with cancer research. But these NK cells say, there's a cancer virus inside that cell. We had no idea they do it. And they attack these cancer cells and kill them. So these are your immunological surveillance cells, what they're called. They go through the system and they just rely on themselves. They don't have the support of anybody else. They go through a surveillance, and if they find it, they kill it. And they can find things that we have no idea why they're finding it. They're really unique individuals, these NK cells. I thought I froze. Okay, there we go. All right, but this shows the different lymphocytes where they travel. They develop in the bone marrow. Okay, so in the bone marrow, you got all the lymphocytes developing. Then they go to pluripotential stem cells. Remember, that was our blood one also. And they can develop into lymphocytes, and the lymphocyte can go into B cells, NK cells, or T cells. Okay, these become immunocompetent in the bone marrow and travel in the bloodstream. The T cells travel in the bloodstream into the thymus. In the thymus, the T cells now become immunocompetent. They become activated, and they can travel back in the bloodstream and now destroy, okay, other cells. They have the 4 types: the memory cells, the suppressor cells, the cytotoxic cells, and I'm drawing a blank on the other one. Okay, they allow the T cells to perform their functions and become immunocompetent when they're in the thymus. Okay, who was paying attention? I don't know if it's gonna be the right or left side. What's the left side here? What drains that area? What vessel drains this whole area right here, this whole right side above the diaphragm? The right lymphatic duct. What drains the whole left side of the body and the whole right side up to the diaphragm?
Thoracic duct?
Thoracic duct. Okay, this is drainage of the right lymphatic duct. This is drainage of the thoracic duct. Okay, this is your thoracic duct, and you'll see this on your final. Thoracic duct drains the whole left side of the body, plus the right side below the diaphragm. The right lymphatic duct drains the right side of the body above the diaphragm. That's it. That's how they drain. And like I said, there's no advantage to it just doing that, but that's just how it develops embryologically. Lymphocytes and your immune response. There's 2 response mechanisms. Okay, there's cell-mediated immunity and there's antibody-mediated immunity. Cell-mediated immunity are the T cells directly attack the pathogen. The antigen comes in the body, the T cells goes, hey, this doesn't belong here, it's foreign, and kills it right on the spot. So, the antibody-mediated is the pathogens attacked by antibodies produced by B cells. So B cells produce antibodies. The B cells find the surface antigen. The antibody-mediated immunity is the kind we use for our vaccines, like our flu vaccine. You introduce a virus, introduce a pathogen, an antigen. The T cell finds it as foreign. It finds a surface antigen it doesn't recognize. So it marks it. These B cells mark it, and they start making antibodies that mark it more. And you get all these flags that mark it, and these tell the T cells to come destroy it. It says, these are bad. Come fix it. Come destroy it. And it starts to destroy things. Okay, that's antibody-mediated immunity. The other one is just direct T cell mediated immunity. The T cell just attacks it and kills it. So 2 types of ways you can respond to an antigen in your body. Okay, the following sequence of events involve the immune response to bacterial antigen. Okay, if you have bacterial antigen in your bloodstream, macrophages will phagocytize the foreign substance. They'll eat it. They'll destroy it. Or they'll present it, the antigen, to specific T cells. The B cells will mark it, and they'll tell you, look, this is foreign, and give it to a T cell. The T cell will then look at it and destroy it. So macrophage will present it to the antigen to specify T cells. Then the T cells will just divide to produce cytotoxic T cells, helper T cells, and memory T cells, and destroy it. Okay, so if it phagocytizes it right away, it just destroys the antigen. If it presents it to the T cells, these T cells put out helper T cells, which makes more antibodies, more B cells. Memory T cells, which stores it in memory. So if you see it again, you can destroy it faster. Your body's already there. And cytotoxic T cells to help destroy it. So those are your 2 pathways. Okay. Cytotoxic T cells will kill bacterial agent directly. The helper T cells, remember, helper T cells activate B cells. Suppressor T cells stop it once it's done. B cells begin to produce antibodies against the bacterial antigen. Antibodies bind to the bacterial antigen. The antigen-antibody combination will attract an army of these T cells, the leukocytes. These leukocytes will then kill the bacteria. That's the difference between cell-mediated and antibody-mediated response to an antigen in your body. Okay, so in the blood, the ratio of T cells to B cells is 8:1. So there's 8 times the T cells there is B cells. In the spleen, it's 1:1. In the bone marrow, it's 1:3. There's more B cells in the bone marrow because that's where the B cells are maturing. The T cells have left. They went to the thymus so they can mature there, become immunocompetent. Okay, so in the blood, there's more T cells floating around to destroy things. In the spleen, it's a 1:1 ratio where things are being recycled. In the bone marrow, there's more red blood, there's more B cells than T cells, since the T cells have left become immunocompetent in the thymus. The lifespan of antibodies and lymphocytes can be 4 to 20 years. Really big lifespan. Okay? The antibodies for tetanus have a lifespan of about 5 years. That way we get booster shots. Booster shots reintroduce the original antigen, so we boost up our immune response to getting tetanus. We don't get tetanus. Okay. Lymphopoiesis, the development of lymphocytes, lymphocyte production. Just like erythropoiesis, it can be the same type of thing. The pluripotential stem cells, that's the one that produces all our red blood cells also. That is erythropoiesis or lymphopoiesis. Okay? It produces two sets of lymphoid stem cells with different fates. Okay? One set migrates to the thymus gland and becomes T cells. The mature T cells ride in the peripheral tissue or circulate through the body. Okay? The other set become B cells and NK cells. These stay in the bone marrow and become immunocompetent in the bone marrow. Okay? So B cells produce antibodies. NK cell act as surveillance cells. NK cells act alone. B and T cells has a big immunological complex where they interact with each other and produce more. They work in conjunction with each other. These NK cells are, like the first ones into a battle scene. They're just all on their own. They function, they go in, they take care of the problem. Okay? Both reside in peripheral tissue or circulate throughout the body. All right, here's the same chart again we did with erythropoiesis. Again, the pluripotential stem cell can develop into your NK cells, your B cells, and your T cells, but the T cells go into the thymus, become immunocompetent, and then enter the blood. All right, lymphoid tissue characteristics. Tissue is dominated by lymphocytes. Lymphoid tissue has an abundance of lymphocytes. Lymphocytes are loosely aggregated within the connective tissue. They kind of just hang out and they're looking for things to destroy. Lymphoid nodules characteristics, and these nodules are little packages of them. They aggregate with a supporting framework of reticular fibers that hold these nodules in one place, like your cervical lymph nodes, your axial lymph nodes. You swell up under your arm, you get infection. You swell up under your jawbone here, we get a flu or the virus. Okay? Your lymph nodes here are going to swell up, your cervical lymph nodes. Okay? They aggregate into this massive connective tissue. Okay? They're supporting network of reticular fibers, and these nodules have what's called a germinal center. And this germinal center inside the nodule contains your lymphocytes. Okay? So you have your pharyngeal lymphocyte, your tonsils, you have your palatine tonsils, and your lingual tonsils. Those tonsils are all lymphocytes. What the lymphocytes do is bond to and attack and store in those areas antigens in foreign bodies. Okay? You see the germinal centers here on this light microscope picture, and all these little nodules have lymphocytes stored inside of them. So when infectious material gets inside these nodes, like in the tonsils, they swell up, your tonsils swell, these lymphocytes attack it, and they start to destroy it. Okay? The tonsils, they used to take out these pharyngeal tonsils on a regular basis. Okay, they don't do that anymore because they found out what's called they found out that these tonsils keep the infection going down deep into your bronchial system. Okay? You want to keep the infection out of your lungs, and that's what it does here. That's where your tonsils get swollen. It's better there than in your bronchial system. Okay, there's different types of nodules. There's the MALT nodules, mucus-associated lymphoid tissue. Okay, there's tonsils, the pharyngeal tonsils, palatine tonsils, and lingual tonsils. And you have aggregate lymphoid nodules. Those are your Pierre patches and your appendix. The appendix is on the digestive system and attaches to the cecum, which we haven't talked about yet, but it's the very beginning of the large intestine. We saw that in the lab on Monday. So MALT is lymphoid nodules that are associated with the digestive tract. Okay, they're around the digestive. Just think about it. Your digestive tract, where's a lot of your bacteria going to come from? Your digestive tract. The food you eat, basically in your mouth, is not sterile. Okay, a lot of your bacteria and pathogens come from your digestive tract in your body. That's where you have its extensive association of MALT, which is your mucus-associated lymphoid tissue that surrounds your digestive tract. So things coming through there, it can find things as foreign. There's 5 sets of tonsils. There's a pharyngeal tonsil in the back of the throat. There's 2 palatine tonsils on the roof of the mouth, and 2 lingual tonsils at the base of the tongue. So there's 5 sets, 2 lingual, 2 palatine, and 1 pharyngeal. Again, and those act as a ring to help protect things from getting airborne, getting down into your lungs. Okay? You got the aggregated lymphoid nodule, your patches, and your appendix. They're associated with the small intestine, where again, more food comes in, your patches. Okay, and the appendix is where food has gone through into the large intestine. Okay, so here's your pharyngeal tonsils, and then your palatine tonsils. Okay, there's two of those, one on each side, and your lingual tonsils. And you'll see where those 5 sets are located. Okay, the pharyngeal tonsil is a singular tonsil just above the palate. Okay, below the palate, you have a palatine tonsil, which is 2 right and left. And below the tongue, there's lingual tonsils, 2 right and left. Okay, lymphoid organs are your lymph nodes, the thymus gland, which where your T cells go to become immunocompetent, and your spleen. Here's a picture we showed before, the different distribution of your lymphatic system. Again, here's your succinate cilia, which is your thoracic duct, beginning of the thoracic duct that drains everything upwards. Axillary lymph nodes, cervical lymph nodes, tonsils, malt tissues. Okay, these are all areas where pathogens are going to enter into the body, where you want high concentrations, of lymphatic tissue. Your lymph nodes are scattered throughout the body. They're usually 1 to 25 millimeters in. Hiccups. Yeah, they're scattered throughout the body, 1 to 25 millimeters in diameter. But they're really concentrated, highly concentrated in the cervical area, under your jawbone here where food comes in, axillary region, your breasts, abdominal region, and your inguinal region. Again, that's what the concentration of these lymph nodes are. Axillary, inguinal, which is your lumbar one, and cervical. A lymph node actually consists of afferent vessels. The caps, afferent vessel means what? Afferent meant what? Coming in or out? Afferent is coming in. Yeah, those are your sensory nerves, or your afferent nerves. Your vessels, afferent vessels, your vessels coming into the lymph node. You have what's called a subcapsular space below the capsule. You have an outer cortex. Everything, the cortex is always the outer layer. Medulla is always the inner layer. In between there, you have a germinal center where the lymphocytes develop, the lymphocytes reside. Then you have your medullary cords, which connect in between it, and the hilum. The hilum is where things come in and out, and your efferent vessels. Efferent is vessels going out. Afferent is coming in, efferent is going out. Okay, here's your hilum. This is where your blood vessels and everything are. Okay, this is where everything comes in. It comes into these areas here. These are afferent vessels. This is the cortex. This is the medulla. You have your subscapular space. Okay, and these are where the B cells, T cells, the B cells, T cells, and all the lymphocytes are formed. And the hilum is where the lymphatic drainage comes out. So your afferent is all around the sides. Your efferent is at the hilum. The hilum is your arteries and veins come in and out, okay, along with any nerves. Okay, and this is what the lymph nodes look like right in here. These little white, like rod-shaped things. They're kind of a squished circle. So lymphoid tissues, lymph nodes are in high concentration, where the body is susceptible to injury or invasion from the pathogens coming in. Like when you breathe in air, when you take in food, that's when infections get in your body, and that's where these nodes are concentrated at. Okay, like I said, we have the cervical lymph nodes, which are the head and neck region, which are just behind the angle of the mandible. That's what you feel when you get sick all the time. You can be swollen up right on your chin here. Okay, and back towards the mandible. You got the axillary lymph nodes, now the axillary region. They filter lymph from your trunk and arms. In women, it filters lymph from the mammary glands. The popliteal lymph nodes filter lymph from behind, from the legs, from by the kneecap. Okay, here's all the lymph nodes you're associated with the head and neck area. And you can see the cervical lymph nodes are right below the jaw here. And this is your parotid salivary gland right here. That's your submandibular gland. But your lymph nodes are concentrated in the cervical area right below here. And then they drain, okay, into either the right thoracic duct, if it's on the right side, or the thoracic right lymphatic duct on the right side, or the thoracic duct is on the left side. Okay? But these are all your different cervical lymph nodes and the different occipital lymph nodes, periocular lymph nodes, etc., depending where they're located. That's an extensive system of the head and neck. And here's your congregation of in the axillary area, the axillary lymph nodes. Okay, and in females, the mammary lymph nodes. Okay, pectoral lymph nodes. They're concentrated in the breast region. And the inguinal areas, again, a concentration of all the lymph nodes there. And there's a concentration here in the popliteal region. Okay, so your inguinal lymph nodes filter lymph from your lower limbs and your trunk. Thoracic lymph nodes filter lymph from the lungs, respiratory passageways, and the mediastinal structures. Remember, mediastinal refers to the space between the apex of the right and left lungs. So you have your heart down here, pericardial cavity, you got your lungs on both sides. As the apex of the lungs peak up, right between the right and left, that's your mediastinal cavity, that's your mediastinal area. Abdominal lymph nodes filter lymph from your urinary and reproductive system. Okay. If you dissect a cadaver, here's what a deep inguinal lymph node would look like. Those are what lymph nodes look like right here. Okay. And this is a congregation of lymphatic tissue, B cells, T cells, NK cells. And when they find an infectious agent, they store it in there. Those lymph nodes swell up because they start producing more lymphocytes to the area, and they become swollen and they fight the infection. Okay. Again, your inguinal lymph nodes coming in that area, and your thoracic lymph nodes. Okay. Intestinal lymph nodes filter lymph from the digestive tract. Mesenteric lymph nodes filter lymph from the digestive tract also. The mesenteric covers over your digestive system. Again, here's your digestive. This is the large intestine only. Small intestine comes up from this area here and feeds into here. But this is the secret we talked about, and it's a little extension here. That is your appendix. And as people evolve, the appendix is getting smaller and smaller and smaller, and pretty soon they won't have any because it's not used for much anymore. We don't need a lot of toxins in our diets. Okay, but that's lymphatic tissues. That's where the appendix is located. Then this is your large intestine. Like we haven't gotten into that yet, but this is your ascending. This is your transverse. This is your descending. This is your sigmoid. And that's your rectum as you go through the digestive system. And those are all the lymph nodes associated with each of those sections. The thymus. Remember where the thymus sits? Not by the thyroid gland, but just below it and inferior to it. The thymus is posterior to the manubrium of the sternum. Okay. Remember, your thyroid's anterior to it. Your thymus is posterior to it. Its greatest size is reached by age 1 or 2. Okay, that's when it gets greatest size. Reaches maximum size before puberty. Diminishes in size after puberty. There's 2 thymic lobes, the left and the right, and there's numerous lobules separated by a septum. Okay, remember your thyroid gland has 2 lobes separated by an isthmus. The thymus has 2 lobes separated by a septum. Consists of a cortex and a medulla. Okay? The cortex are stem cells that differentiate to form the T cells, and mature T cells migrate to the medulla from the cortex. Okay? The medulla consists of T cells that remain inactive until they enter the circulation. They go into the area, and they become immunocompetent. Thymic corpuscles are in there. They're not quite sure what the function is of thymic corpuscles. Okay? But here's your thymus. And again, you have a right lobule, a left lobule, and it's separated by a septa. This is your septa right here. Okay, so here's your septa, which separates this area. This is your right lobe. This is your left lobe, and then lots of lobules. Okay, you see the septa coming in, separating it here. This is the medulla, which is your inside. This is the cortex, which is the outside. T cells migrate from the cortex into the medulla where they become immunocompetent. Okay, these are your thymic corpuscles, which no one's really sure what they do, but they are in the thymus. Spleen. Spleen is the largest lymphoid organ. Okay, it's located on the left edge of your stomach. It's attached to the stomach by the gastrosplenic ligament. Okay, and that's where your spleen is located. okay, on the left side of your body. Consists of a diaphragmatic surface, where it goes up against the diaphragm, and a visceral surface. Okay, contains the visceral surface is the inner portion that contains the hilum, where the arteries and arteries and veins enter and leave. So here's your hilum of the spleen. You have the renal area, it goes into the kidney, the gastric area by the stomach, and this is the hilum. The hilum is where your splenic artery, your splenic vein, and your vessel enter into the spleen. The spleen consists of a capsule, red pulp, and white pulp. Capsule surrounds it. The red pulp contains large quantities of red blood cells. And the spleen is full of red blood cells. It recycles red blood cells. And the white pulp forms your lymphoid nodules. Function of the spleen. What the spleen does is a filter for blood. It's part of the immune system. Old red blood cells are recycled. Stores platelets and white blood cells, and helps fight bacteria that cause pneumonia and meningitis. Those are the functions of the spleen. That's the largest lymphoid organ of the body. And you see the white pulp, sorry, or nodules, your capsule surrounds it, your red pulp, which is your red blood cells, one of the trabecular arteries going through it, and then the central artery coming through it there. As we age, everything goes downhill. After 21, your body starts to go downhill. T cells become less responsive. B cells become less responsive. And the thymus gland eventually disappears, diminishes in size, keeps replenishing. So your immune system really becomes less. Older people are much more susceptible to bacterial infections, to viral infections than younger people, because our T cells become less responsive and the B cells become less responsive as well.